So today we are thrilled to have Barry Brayshaw with us. Barry has been the director of the Physician Locum Services program since 2006. And if you're doing the math, that's 18 years. We are also hoping that we'll be able to hear from Dr. Amandeep Brar, who will share his personal experience working as a rural locum physician. As is the nature of the role, Dr. Brar was called in to see a patient this morning, so he's going to try and join us as soon as he is able to. But for now, I will turn things over to Barry to get us started.
Great. Thanks so much, Lindsay. And also Teresa Simpatico-Fadi, who is the Rural Locum Program Coordinator and who has been there much longer than I have at Physician Locum Services. She has over 25 years with the program. I'll do the presentation and Teresa will be available for questions as well, based in her wealth of knowledge. But without further delay, we'll get into it. So thanks very much for the opportunity to present today. I'm going to try and provide some information about Physician Locum Services at the Alberta Medical Association. So I thought I would just start with some general information about, why do people locum? What's the appeal? And I think the main thing is the flexibility of locuming, and especially for new grads, the flexibility and the diversity of the experience that they get, the opportunity to go into different communities, see different styles of practice, especially if you're going into people's offices. You get an opportunity to see what works and what doesn't work. And if you're setting up your own practice in future, you then have the opportunity to incorporate those lessons into your own practice. So benefiting from the experience you've had during your period of locum coverage. Also, great income without long-term obligation, which really leads to work and personal balance and flexibility. And in some cases, you might find future associates or partners or even a practice group to join. And we've had lots of our locums, both in GP and specialist programs, who have found their future jobs based on doing locum coverage with the program. So some of the things that locums think about when they're considering providing locum coverage, how long are they locked in for a period of service, and how does that fit with their future availability? Does it accommodate their schedule and either their personal or their professional plans? And also, how much assistance or support is provided to the locum during the period of coverage, and what's the responsibility for post-locum follow-up? So, test results, those kind of things, and also responsibility for the mundane things like travel and accommodation and other associated costs. I think ultimately one of the main considerations too is what is the net income going to be for the locum physician? So revenue minus costs, what am I going to leave the period of locum coverage with afterwards? So as far as finding locum opportunities, you probably know there's great demand for locum coverage. Too few locums, too much demand for locum coverage. Lots of informal resources. So especially for physicians who are finishing their periods of coverage, a lot of times we get preceptors who are asking, once you're done your training, can you come and do some locum coverage to me? Locums talk to classmates and colleagues to find opportunities. Specialists can talk to staff physicians in facilities, and that leads to finding locum opportunities. Lots of contacts within AHS, department heads, program heads, and even making calls to clinics and facilities can lead to coming up with locum opportunities. And some organized resources. So you can check all these out online. Cherry Health, it's a relatively recent matching service. It's actually one of our locums who saw a need and has created a matching service for physicians and locums to be able to post their interests and hopefully match and find some coverage. Dr. Jobs Alberta through Alberta Health Services, Jobs plus locum opportunities. Indeed has opportunities, locum opportunities. And then lastly, Physician Locum Services, which I'll provide a bit more information about right now. So So physician locum services exists really for retention and the retention of family physicians in small rural communities through the rural locum program and retention of regional specialists outside Edmonton and Calgary through the specialist locum program. As well, we're trying to create balance and provide respite for physicians. So really by doing that, creating the balance and respite, we're trying to improve the practice lifestyle of the physicians by giving them a break, some time away from practice. So again, balance. And for locum physicians, it's a flexible practice option. You'll see that word flexible come up a lot through the presentation. So the opportunity for locums, and again, especially for somebody who has just finished their training, there's the opportunity to use and enhance skills that you've had through training or possibly through past practice. So the professional experience, business experience, again, you're going into different practices, seeing what works, what doesn't work, and hopefully incorporating that into your what is really a small business for a family practice clinic. And as well, the opportunity is excellent compensation and really low or no expenses. We offer an income guarantee and payment of some or all expenses, and I'll say a bit more about that in a minute. So specifically, what are our programs? We have what we call the regular locum program. So it offers office coverage and emergency room coverage. So that would be evenings, nights, weekends, in addition to the office coverage. That's in communities with fewer than 6 physicians. We have a weekend locum program, and this is rural emergency room coverage over weekends in communities with fewer than 4 physicians. And then same kind of program, but in larger communities. So the seniors weekend program, again, weekend emergency room coverage in communities with fewer than 16 doctors. And the physician who is requesting the coverage is 54 years of age or older. And the intent of this program is to really remove the rigors of on-call, which is one of the worst parts of practice, and hopefully keep physicians practicing in their communities a few years longer than what their normal retirement age might be. And then a relatively recent addition to our programming is a GP special skills program. So family physicians who are doing anesthesia, obstetrics, surgery on an additional skills basis can access locum programs. So instead of doing one-in-one call, they have an opportunity to get away for a period of time, week, couple of weeks, whatever the case may be. We have more than 70 communities that we provide GP coverage to through the various programs. And there's quite a bit of variation based on the communities and the coverage we provide. So variation in community size, places like Milk River and Ponoka that vary in size, variety in patient volume. So especially like a student, somebody who has just finished their training, they may not want to go into a really busy emergency room right after they have finished training. So we can sort of ease them in by sending them someplace a little bit quieter and a little bit lower volume so that they're not overwhelmed. Remoteness as well. I mean, we have places like Mayerthorpe and Langdon, which are in close proximity to Calgary, Edmonton, all the way up to places like High Level, and I mentioned Milk River previously, where you're traveling a significant distance to get to the communities. And also in terms of coverage, I mean, we have actually shorter than 12-hour periods of coverage, 24 hours, full weekends, weeks, 5-7 days, up to just under a month in periods of coverage. So a real variety across what the offering is for locums. I'll say a bit about the specialist locum program as well. We have over a dozen specialties in more than 12 communities that we provide specialist locum coverage for. I've got the 5 regional centers listed here, and they get pretty much all of the specialties that we offer through the program. Those are listed. And then there's a number of other communities where specialists are practicing, and we offer really on the basis of supporting the specialists in those communities, and so listed here. Program funding. So we have a grant agreement with the Alberta government under which the funding for the regular locum program, the special skills, and the specialist locum programs are provided. And then RhPAP has kindly provided funding for both of the weekend programs. Some stats just to give you a sense of the program. We have just under 700 rostered physicians. There's the breakdown of GPs and specialists. And I just pulled stats for a recent year. So we had about November 1st last year to October 31st of this year, we had about 320 physicians who worked through the program. So, I mean, compared to the 700 we have rostered, just shows that not everyone is active all the time. Sort of ebbs and flows. We had 132 physicians whom we recruited during that period of time. And something I found interesting was that we only had 7 resignations. So I think saying that the locum physicians are liking the program and really not resigning based on the experience they're having. And also to give you a sense of the kind of coverage, the volume that we're providing, just over 9,200 days of coverage requested. That's across all of the programs during that 1-year period, and about 7,100 days filled. So about a 77% fill rate for the program. For specialist coverage, about 4,300 days of coverage requested with 3,500 days filled. So about 80% fill rate. And for GPs, about 4,900 days of coverage requested and 3,600 that were filled, about a 75% fill rate. So if you're signing a contract with Physician Locum Services, again, flexibility. So we don't have a term associated, so you can stay with the program on roster as long as you want. And there's no minimum number of assignments or no service that you're required to provide. So again, flexibility in how you're signing on with the program. The locums select the assignments that they want to take based on their schedule, their interests, their skills. And after they get a chance to talk to the physician requesting coverage, they get to make the decision whether they accept the assignment or not. And then we put all the arrangements in place to support them to provide the coverage. And we do try to provide as much notice as possible. I mean, sometimes somebody is sick, we get a couple of days or a week's notice, a month, up to and over 4 months of notice where possible. And we also, for our family practice physicians, we do try and do a bit of suggested coverage scheduling for them. So 3 times a year, based on where they've been before, where they say they would like to go to again. Teresa puts together some suggested periods of coverage, and they can select if they want to go to those periods or not. This is in the interest of trying to provide more coverage to the rural physicians. And then anything that is left over or any new requests we get, we just send them out on an email on at least a daily basis, sometimes several times a day. The unfilled requests go out to our locums. As far as the benefits, we have an income guarantee, which I mentioned previously, $1,000 per workday for family physicians, $1,500 per day for specialists. And again, these are fairly low amounts compared to what they are probably going to make, but it's just to guard against somebody seeing a very small number of patients or nobody at all over the course of a weekend. And if revenue is, so the claims and on-call revenue is greater than the income guarantee, we give them a top-up of revenue. And if it's less, the locum walks away with the income guarantee amount. And just for reference, we don't have any administrative fees, and we don't take any portion of the revenue that is earned by the locum physician. A couple of other benefits that are actually paid by government. If you're working in an office, you qualify to get payments under the business cost program. So that tops up your fee-for-service earnings. And we have approximately 60 communities that qualify for rural, remote, northern incentives. So that's anywhere from a 6 to a 34% top-up premium that's paid on top of your fee-for-service billings. And that just provides some incentive to go to some of these more remote communities and provide locum coverage. Specific benefits, every assignment has a $500 to $1,000 travel honorarium. So that's compensation for your time. And that's for the round trip travel, $500 to $1,000 for each period of coverage. All Alberta travel is covered. So if you're flying, if you have a car rental, that's all covered off. If you use your own vehicle, we pay mileage. And we do actually make a lot of payments for out of province. And we do have a lot of locums who come from out of province, BC, Ontario, etc. Accommodation is provided. So if you're doing a GP office coverage period, the rural physician is providing that coverage. Otherwise, for facility coverage, Alberta Health Services is providing the accommodation. And for GP locums, we also provide reimbursement of ACLS and ATLS course costs, as those are required for membership in physician locum services. We have created what I think is quite a attractive overhead structure. So the maximum that a GP will pay when they're doing office coverage is $200 per weekday. During 2023, it actually worked out to about on average, it worked out to about a 5% overhead. And when you consider you can be paying 20, 30, 40% in other cases, this should make it attractive to provide coverage. What we do is we top up that amount of money that is paid by the locum physician so that the rural physician receives $325 per day. And locum physicians don't pay any overhead on weekends. Some of the softer benefits, we help with paperwork, so getting privileges. We have people who can schedule flights and vehicle rentals for locums. We do provide an orientation to the fee schedule, and this is especially important for out-of-province physicians or somebody who hasn't billed before. It really gets them off on the right foot as far as doing billings. And we do have a billing app that locums can use to submit their claims to PLS. And one other thing is the level playing field we have for all periods of coverage. There's no need to negotiate a contract. So that's one thing taken off your plate as far as having to go back and forth and negotiate terms for your contract. To practice as a PLS locum, you of course have to have your medical license for the province, CMPA coverage. You have the option of joining the AMA as a member, and you of course have to be able to get your medical staff appointment and the appropriate privileges for the period of locum coverage. And for GPs, we require that they have current ACLS. And then we also provide assistance in getting your AHS medical staff appointment and hospital privileges, and also your billing number for the province. Now, these survey comments are from several years ago, but this was a survey of our locums. And so 94% of the locums were recommending PLS as a practice option for colleagues. Here's a comment just talking about the good experience and the good support that they had from PLS staff. And I had mentioned about locuming if you're a recently graduated physician. This is specific to family physicians, but recommending it to graduates as a positive experience after completing your period of family physician training. Remuneration, we had the vast majority of the locums saying yes, PLS provides a competitive level of income. Also, as a flexible practice option, almost everybody that took the survey agreed with that. And the level of interest and challenge, again, almost everyone agreed with that. And we also did a survey of rural physicians, and these were some of the comments provided by those physicians. So just to the value of the program and how much it was meaning for them. So, and hopefully that gives you a bit of an overview. And if you have questions, Teresa and I are happy to try and answer them. Thanks very much.
Thank you, Barry. I think before we turn things over to questions, I see Dr. Brar is here and able to join us, which is great. So we'll maybe let Dr. Brar speak just in case he does have to run again. As a brief intro, Dr. Brar is an international medical graduate who completed his family medicine residency at U of A in 2012. He has a full-time family practice blended with a walk-in component in Calgary since 2013, and he has been doing rural, urgent, and ER coverage locum in various communities, including a couple in my area, which would be Claresholm and Bassano. And so Dr. Brar is here to just share some of his personal experience being a rural locum and talk to you guys about what he enjoys about the program and why he has been doing it for so long. So welcome, Dr. Brar.
Hi, good afternoon, everybody. I'm Dr. Brar. one of the family physicians in Calgary. I've been doing this locum program almost like pre-COVID, I guess. And what really got me into this program, which I feel was really good, is the diversity of skills you acquire when you work in I wouldn't say less resource settings, but obviously rural settings. The support was there. As Barry was mentioning, I didn't hear all his presentation, but I think getting on board signing it was seamless process, to be honest with you. And then the billing was taken care of. So I think I really thoroughly enjoyed doing locum programs. Wish I can do more of this, but being a busy family doctor in Calgary, it takes a lot of time. But I do feel the rural communities have quite a bit to offer in not only in the skill sort of building for physicians, but also just getting to know the communities and helping out. It's a good thing.
Thanks, Dr. Brar. I appreciate you sharing your experience with us. I'll maybe open up the floor for questions now, especially if there's any for Dr. Brar, because as we know, physician schedules are busy and we saw that this morning. So if anybody does have any questions, please feel free to put them in the Q&A box. If you send them in the chat, they'll come right to me, so I'll see that as well. So there was a question that actually did just come to my chat, which was, do you have any suggestions for retaining locums? This community struggles to find locums for the clinic. They don't qualify through PLS, and Cherry Health has not had much activity from them. So perhaps maybe Barry, from a professional side, any suggestions on retention, and maybe Dr. Brar from a personal side, what's retained you to some of these communities?
I think what I've seen in the last few years is that the more of the younger physicians require more flexibility. I think gone is the time when I can say, okay, what, I'm going to settle in one community and do full-time practice over here. So having that flexibility of maybe doing 2 days per week or even a week per month, it just opens up a lot of opportunities and gives that fear of permanent commitment is taken off. And and doctors are ready to come in and practice and do 2 days, 3 days, whatever allows them. So I think it's having a group practice, dividing the hours of the days. I think that's a good way to retain doctors if that's what my understanding is. And Barry can add to that. Hopefully there's another ideas there.
Yeah. I don't know. I think one of the main things is showing appreciation and valuing the fact that physicians are in or show up in your community, making sure they have a good experience interacting with staff. If you're hosting locums, and I'll get Teresa to maybe comment as well, but one of the main things we get comments on is accommodation. And when somebody has, and it seems simple, but when somebody has really nice accommodation, they tend to want to come back. They have it all contributes to the experience that they have. In terms of physicians who are residing in a community, I always remember when I was in East Central, one of the physicians there, he used to talk about the way the community had integrated he and his family into the community. And he said even things as simple as when the community knew he was on call, and there was a snowfall, which we get lots of times in Alberta, they would come out and make sure his driveway was plowed so that, he was able, when he got a call, bang, he was able to get out and provide the coverage. And, just simple things like that, demonstrating the appreciation and the value.
Another question that just came through the chat was, in what situation would a locum be paid directly by a physician or the community, or is this even possible?
Paid directly, I guess, if you wanted to provide a top up, and if you wanted to contract privately, I mean, we have our contracts and we make our payments to our locum physicians. But if you have a private contract with somebody, you will be making payments based on the terms in the agreement.
Another question here. Finding locums is the main struggle. So any suggestions, Barry, on, maybe what communities can do if they're struggling to get locums in the first place?
Again, those resources that I had mentioned, Cherry Health and Alberta Doctor Jobs, even contacting medical affairs, AHS medical affairs in your zone and making them aware of the need. And it's funny because I had somebody out of Red Deer asking me about opportunities for IMGs, people who are on sponsorship, to do some locum work through our program, because they're actually actively looking for opportunities to provide emerge coverage. There sometimes the need and the supply don't connect. So I think it's just to reach out and make AHS aware as well.
Out of residency, how long does it take to become approved by Physician Locum Services to start locuming?
Out of residency, actually, we take people on. I'll have somebody contact me, 6 months before they're graduating, and we will start to accept their documents at that point. We start a file for them, and then as they get their documentation in order, we just add it to the file. And once they get their CCFP and have their general register, they're able to work with us. And I guess we had somebody who contacted us out of BC earlier this week. He contacted us on Monday. Now, this is an exceptional case because the documentation was all available from Alberta Health Services, but he contacted us Monday, and we interviewed him on Wednesday. And so he's going to be going on December 3rd and providing locum coverage. He had it all set up already. But we were able to get him into the program and help him with coming to the province, and he's from out of BC, and provide coverage.
Who is responsible to book the locums for the physician in the community?
Really, it can be the physician contacting us and saying, hi, I've talked to Dr. Smith, and he's going to be coming this date to this date. Sometimes the locums will tell us. Sometimes Alberta Health Services will give us a heads up on it, and we will follow up with the locum or the community. So, I mean, we're pretty flexible. We don't have a hard and fast process for booking periods of coverage.
Goes along with that flexibility that you mentioned.
Yeah, roll with the punches.
Dr. Barr, feel free to share if anything's popped into your head throughout the conversation. Please feel free to jump in.
I think, as Barry mentioned, accommodating and just the community welcoming the physician is a huge part of retention, I guess.
Hi, I'm so sorry. I'm not able to raise my hand, but can I just jump in?
Yeah, absolutely. Go ahead, Ashley.
Awesome. Well, thank you both so much for your presentation and remarks. I was writing down notes as fast as I possibly could. It was so interesting. So a couple of questions for you. So you talked a little bit about locum mobility and physicians occasionally coming from other provinces, and Dr. Barr coming from Calgary and going to communities like Lozano. I was wondering if there were maybe other forms of mobility that you were seeing, or if there was one form that was maybe more prevalent, like urban rural, or maybe there's physicians going, like rural physicians locuming in other communities. So if you could speak to that a little bit. And then the second question was just getting a sense of your understanding of physicians who are using the AMA physician locum service, maybe who's using other services that you mentioned, and why you think that is. Yeah, so thank you so much. Really loved your presentation.
In Bassano, I've seen, once the physicians are sort of well settled in the community, they will occasionally pick other locums. Like I've seen people going from Bassano to Brooks, doing covering shifts, right? So there is a bit of mobility, but again, I think it's all about the skill set and the comfort level of the physician. For me, just with my experience before Barry, I signed with AMA. I did a 3-month fellowship in Prince George for emergency medicine. That was like a mini fellowship, just, getting comfortable. And then obviously it's not a full-fledged sort of training, but, better than, just being a family doctor. I would see myself, so for example, I was in Claresholm last weekend, Bassano. So I would not go to the big center. So the mobility is restricted there because I think the skill set will restrict you. I cannot pick up Red Deer, or I cannot pick up other very high acuity ERs. But, urgent care, remote rural, so those are sort of would be the comfort level. So I think, again, the skill sets is the main determinant of your mobility. If you feel really, really comfortable, you can pick up shifts, Grand Prairie or the more busier centers. Would that make sense, Barry?
Yeah, I would agree. I think based on interest and experience as well, the number of people who contact us, so they're working with us, but they're also going to Yellowknife, they're going to Yukon, they're going to more remote places, just based on the kind of experience they want to have, quite honestly. And yeah, I think mobility, it's kind of based on, for a lot of people, it's very individual. It's based on your past experience and your interest. What is interesting to you? What kind of experience do you want to have professionally, and perhaps when you're not working? And I think locum coverage can facilitate that for a lot of physicians. So I think that drives the mobility. As far as who's using AMA versus other I'll say locum opportunities or locum programs, we don't really have any insight into who's working privately or working with Cherry Health. I mean, that's all confidential information. So, I only know who's with us, and if they happen to mention that they're working somewhere else or doing private work, then we're aware of that. But
are there any funds available for locum housing?
So we don't provide accommodation, but as I said, accommodation is provided either by the rural family physician, if somebody is doing clinic coverage, or by Alberta Health Services. And so Alberta Health Services, if you're going to work in a facility to provide emergency room coverage, they will provide a hotel room, or if you book an Airbnb, in most cases, they will reimburse the cost of the Airbnb. So they have some flexibility around how they pay for accommodation.
There was another question that was, can the physician choose which locum they would like to cover their time, or does the AMA or Physician Locum Services determine who comes to cover?
No, it's completely open, basically. Like if somebody doesn't want a particular locum to cover their practice, they can let us know that, and we will discreetly say, sorry, something's changed and you can't provide the coverage. And likewise, the locums have full control over who chooses to go where.
What we're finding more and more happening is that if locums have an excellent experience in a community, that they directly reach out to that rural physician and say, hey, I'm available during this period of coverage. Can I come back? So when a positive experience is had by the locum, as well as that rural community, if they're impressed, if nursing staff are impressed with the way the physician works collaboratively with nurses and how patients are dealt with, we find that those communities ask for specific locums consistently. And that really is excellent patient care. When a locum is familiar in a community, they're familiar with patients, the way things work in a community versus that constant, how does this site work? So what we see is after several years with the program, locums kind of have their niches where they go to repeatedly, and we see that as a win-win for patient care. Everybody's familiar. And so we see that as a positive through this program.
So Ashley did have another question. Thinking about locum physician demographics, are you seeing primarily new grads choosing to locum, or are more experienced physicians like Dr. Brar choosing to go out and locum?
My opinion, I would say there's a little of each. It's probably skewed more towards graduating and young physicians. So within their first, 3 to 5 years, we do have physicians who are contemplating retirement, and it's a case of I don't want to quit completely. I want to continue, but I don't want to be doing the level of coverage that I'm currently doing. We just had a general surgeon sign on with us this past week, and that's what she was saying. I mean, she's going away and doing some medical missions. She's going to BC and doing some work, but then she also wants to go out into Alberta, the regional centers, and do some work there.
What is the process for placing a job opportunity on AHS or the Dr. Jobs Alberta site?
I'm not sure if, I mean, again, it would be contacting medical affairs, but I'm not sure if you're able to actually post to Alberta Doctor Jobs. Mm-hmm. So unless it's an AHS sanctioned opportunity, if I can put it that way. But if you contact the medical affairs in your area, your local area, they should be able to help.
When I graduated from U of A, so there's a website called FMRA, which is Family Medicine Resident Association of U of A. So they'll post a job website, and they'll have a list. And I think similar is with the U of C as well. So those would be the other two places to post the positions, I guess, or locum positions.
Yeah, that's great information to have. And Nicole, I'm not sure if you're tied into one of the attraction retention committees in your area that RhPAP works with, but the consultants are often connected in with the physician resource planners and medical affairs in that area. So there's definitely some channels where you can lean on RhPAP to support getting that information and making those connections. So feel free to connect with us after the session if that's something that you would be interested in getting some more information on too. So thank you to Barry, Teresa, and Dr. Brar for sharing their expertise and their knowledge with us today. We do really appreciate your time.